Now I'm going to go over intellectual disabilities or intellectual developmental disorder. The diagnosis of ID depends on the individual's severity level. So mild is ICD code F70, moderate is code F71, severe is F72, and profound is F73. Intellectual disability is a disorder with onset during the developmental period that includes both intellectual and adaptive functioning deficits in conceptual, social, and practical domains. The diagnosis is based on both clinical assessment and standardized testing of intellectual and adaptive functions. For the intellectual functions category, individuals may have difficulty with reasoning, problem solving, planning, abstract thinking, judgment, and academic learning. And for the adaptive functioning, individuals may have difficulty with developmental standards, sociocultural standards, personal independence, social responsibility, and it can limit functions. And they can be presented as a lack of social judgment, assessment of risk, self-management of behavior, emotions, or interpersonal relationships, motivation in school or work environments, communication skills, or awareness or lack of social cues. And these can often be seen as disruptive or aggressive behavior instead of someone presenting with a disability. These are the severity levels. The various levels of severity are defined on the basis of adaptive functioning and not IQ scores, because it is adaptive functioning that determine the level of support required. So for the mild, the conceptual domain, it is difficulties learning academic skills, abstract thinking, executive functioning, and short-term memory. In the social domain, it is immature in social interactions, difficulty in perceiving social cues, and regulating their emotions and behaviors. For the practical, it is that they need support with complex daily tasks, but can be fairly independent. For the moderate, in the conceptual skills lag behind, and they need ongoing assistance on a daily basis. In the social domain, friendships are affected by communication or social limitations. And in the practical domain, an extended period of teaching and time is needed in order to become independent. In the severe, in the conceptual domain, attainment of concepts is limited and they need support for problem solving. For the social domain, their spoken language is limited, speech may be short, and their communication is focused on the present. For the practical domain, they require support for all daily living and require daily supervision. And finally, for the profound severity, in the conceptual domain, conceptual skills involve the physical world rather than symbolic processes. They have motor and sensory impairments. In the social domain, they have limited understanding of speech or gesture. And in the practical domain, they are completely dependent on others and are unable to live independently. So here are some of the causes of intellectual disability. ID has many causes, and some of the most common can be from injury, disease, or problems in the brain. So these can come from genetic conditions, complications during pregnancy, problems during birth, and disease or toxic exposure. Approximately 6.5 million people in the United States have an intellectual disability, and that is around 2% of the population. When it comes to gender, ID affects more males than females. It is reported that 1.6 to 1 ratio in the mild level and a ratio of 1.2 to 1 in the severe level. When it comes to race or ethnicity, while ID occurs in all races and cultures, it has not been found that it affects one more than the other, but it is shown that Black and Latino adults with ID have worse health outcomes. So this can be due to socioeconomic status, systemic racism, and living situations. And here we can see some of the health outcomes for this population. The development and course. The age and characteristic features at onset depend on the etiology and severity of brain dysfunction. Delayed motor, language, and social milestones may be identifiable within the first 2 years of life among those with more severe intellectual disability, while mild levels may not be identifiable until school age when difficulty with academic learning is apparent. It is generally non-progressive, but it can occur with some genetic disorders, and it is also generally lifelong, although severity levels may change over time. When age is a factor. When individuals under the age of 5 are assessed and the clinical severity level cannot be reliably assessed, it is diagnosed as global developmental delay, ICD code F88. On the other hand, when individuals over the age of 5 are assessed and the degree of intellectual disability by means of locally available procedures is difficult or impossible because of associated sensory or physical impairments, locomotor disability, or presence of severe problem behaviors or co-occurring mental disorder, unspecified intellectual disability or intellectual developmental disorder is diagnosed, ICD code F79.